I was always interested in psychology at baseline, but I have had a few family members growing up that had different neurological conditions that impacted different aspects of thinking and memory. And so I became interested in the relationship between the brain and how it impacts cognitive skills. Specifically, my grandmother had a stroke, so she had aphasia as a result of her stroke, which impacted her ability to communicate. And so that was interesting to see, but also devastating in a lot of ways. And so I think I got a lot of firsthand experience in terms of how devastating some of these neurological conditions can be, and really wanted to learn more about why they work the way they do and any treatments that might be able to help people move forward from the conditions. And so that's when I discovered the niche of neuropsychology. I specialize in epilepsy. So a lot of what I do day to day is understand how seizures have impacted a person's memory and thinking skills. And a good portion of my patients are also considering epilepsy surgery. And so what neuropsychology does in that situation is we try to understand whether the person might be at risk of experiencing any additional cognitive changes with epilepsy surgery so that they can make an informed decision going into that treatment plan. Our visits tend to be very lengthy, so that's usually the first thing I warn patients is you're going to be here for a few hours. So it's very different from a lot of other doctor's appointments that patients have. And the first little bit is me just chatting with the patient, getting to understand the history of their condition. And then for the second part, they actually work with one of our colleagues, a psychometrist, to do different cognitive tasks. And so these cognitive tasks are designed to really assess from an objective standpoint someone's cognitive skills. So that includes memory, it includes attention, thinking speed, all sorts of areas of our brain's functioning so that we can really understand how and if their brain has been impacted by whatever condition they're coming in for. I get to see patients from all walks of life, and I feel very privileged to get to know patients, and it's nice to just be part of that experience, and hopefully I can be a component of their kind of support and treatment through that process.